5:46 now, and in Navy news, you are not alone. There's an amazing program that makes sure that no one gets left behind. We're talking about the Wounded Warrior Program. And joining us this morning is Margot Crane, the Navy Wounded Warrior Region Program Director, and Operations Specialist First Class Robert Hunt, a Navy Wounded Warrior Program participant. Good morning and Happy New Year.
Good morning. Happy New Year.
Now, first off, Margot, can you tell us about the Wounded Warrior Program?
Yes, the Wounded Warrior Program, the Navy Wounded Warrior Program, provides assistance for sailors and Coast Guardsmen and their families with non-medical care needs that they have as a result of a serious illness or injury. So some examples of a serious illness or injury could be PTSD, traumatic brain injury, heart disease, schizophrenia, or stage 4 cancers. So we have individualized care plans that our recovery care coordinators help, along with the sailor, to create to address all of those needs, because not everyone has every need, but we're there for them. We help to provide transition for those that are not able to return to duty. So we help with employment and education opportunities, and we also introduce them to adaptive sports. Our goal is to help them along the way, to help them find their new normal and to be a support system so they can focus on getting well.
Yeah, a lot of times staying active helps a lot mentally, correct?
Very much so, and it helps to give people who may have figured out, you know, what is my next step going to be, what are my next chapters, to help them learn to have a new sense of purpose.
And how many participants does the program have?
We have just about 4,000 wounded warriors throughout the nation in each of our 6 regions.
Now, Robert, how did you get involved in the program?
In March of 2019, doctors discovered just by chance that my aortic valve in my heart had quit working. It was not pumping blood out of my heart anymore. My heart was severely enlarged, and I would need open heart surgery. It was an emergent situation. I was immediately pulled from my ship. I was on a sea command and transferred to shore duty, and life changed forever. My wife, who's a nurse, she was a nurse at Makalapa at the time, now at Tripler. She was familiar with the program and encouraged me to sign up. She made sure that I was referred to the program and encouraged me to sign up, and very quickly I was contacted by Wounded Warrior and enrolled.
And how has that program helped you as well as your family?
It's been a massive help to my family and I. It's put me in contact with sailors who are just like me, who suffer from injury and illness. It allows us to network with each other, help each other out, and support each other as we navigate the military healthcare system. Like I said, my injury was very overwhelming. My life changed completely, and Wounded Warrior stepped in. They gave me a comprehensive care plan, realistic goals that I can set for myself, ensuring that I have everything I need, everything my family needs, setting me up for both my recovery and my possible transition out of the military. Also, they paid for my mother to fly to Hawaii at no cost to us. So a last-minute flight can be very expensive to the islands. And they paid for that at no cost and took that burden off of our shoulders. So she was able to be here for my surgery, which was important to her. I'm only 33 years old. So she was able to see her 33-year-old son go through open heart surgery.
And I'm glad that the doctors found it early before later.
Thank you, me too.
And anything else you want to add about the Wounded Warrior Program?
This program's given so much to me that I just hope that I can give back to this program, and also as I transition out, be able to pay it forward.
Margot?
We like to raise awareness and let people know that maybe are on limited duty or going through med boards, that they're not alone, that there's support out there for them, or people who are having a rough time with major depression and sadness. They're not alone. We're here for them. We have a lot of services at the ready for them. So we would just encourage people to reach out to us. We are in the SMART Clinic across from the Makalapa Medical Clinic on Joint Base Pearl Harbor Hickam. So thank you so much for having us.
No, thank you as well for joining us and helping us explain this program. And if you want more information at home, you can log onto our website at KHON2.com for more information. Thank you so much for joining us this morning.
Thank you for having us.
All right, coming up next, Kelly's got your updated forecast and just